Counterstrain for the quadratus lumborum muscle. The first step in counterstrain is to identify a significant tender point. The tender points for the quadratus lumborum can be found in 3 different locations that correspond to its anatomy, which runs from its attachment on the inferior surface of the 12th rib down to the superior surface of the iliac crest, and also with attachments to the transverse processes of all of the lumbar vertebrae. The first tender point to look for is located on the inferior surface of the 12th rib. To begin, you'll want to identify the 12th rib, being precise in your anatomic palpation. This can be done either by feeling for the 12th rib in the superior element of the soft tissue of the lateral posterior abdomen, or by identifying the spinous process of the 12th thoracic vertebra, which typically is the most prominent spinous process in the mid-lower back, and following the 12th rib out from there. Once the 12th rib has been identified, have a contact just inferior to the 12th rib, sink into the soft tissue just lateral to the border of the paraspinal muscle mass, and apply pressure from inferior to superior, pushing upward on the underside of the 12th rib. If this area is tender, you've identified a tender point related to the quadratus lumborum muscle. The next tender point to look for, moving inferiorly, will be along the lateral border on the superior aspect of the iliac crest, which can be found as is being shown by sinking into the soft tissue on the lateral element of the torso and then applying a downward pressure. The tender point is located just lateral to the paraspinal muscle mass, and you'll push from superior to inferior downward on to the iliac crest where the quadratus lumborum is attached. The third place you may find a tender point for the quadratus lumborum muscle is along its attachments on the transverse processes of the lumbar vertebra. You'll want to sink in lateral to the paraspinal muscle tissues, and then after you've sunk in, apply a lateral to medial pressure until into the quadratus lumborum tissue, where you will be stopped by the bony feeling of the lateral masses or transverse processes of the lumbar vertebra. Once a significant tender point has been identified in any of these locations, the treatment position will be similar. To remind you, first, once you've identified a tender point, in this example, the underside of the 12th rib, you'll maintain your contact there, but reduce your pressure after establishing a relative pain scale with the patient. You'll bring them into the position of treatment or comfort, which in this case will mimic the action of the quadratus lumborum, which is primarily a trunk side bender ipsilaterally. To induce ipsilateral side bending in the trunk, you'll use the leg as a long lever. Bend the patient's knee, grasp their thigh just above the knee, and using flexion, abduction, and external rotation of the hip, you'll induce a lateral side bending in the trunk. Remember to feel for tissue texture changes under your monitoring hand. You will then palpate or apply the same amount of pressure that you used initially to the tender point and ask the patient to report the level of their pain. You'll fine-tune as necessary based on their response until you've reached a 0 or a 1, or in some cases, if unable to get a 0 or a 1, a 2 can be acceptable. You'll then wait for 90 seconds in the position of comfort, again monitoring for any release or tissue texture changes under your monitoring hand while not applying pressure. Once 90 seconds has passed, you'll remind the patient not to assist you in returning their body to a neutral position and slowly return them to a neutral position while, if possible, maintaining your contact at the area of the tender point. Once they've returned to a neutral position, you will retest for continued tenderness. It may be necessary in this case, if the quadratus lumborum is acutely in spasm, to treat more than one of the tender points that we discussed. And a good rule of thumb would be to start with the tender point that's the most significant, then retest them all, and if there's some residual tenderness left, to attempt to treat again, as the position of comfort may be slightly different for the different tender points.